Hey everyone, it's Josh at Prescription Fitness Physical Therapy and Sports Care. I thought take a couple minutes tonight just talk to you about common foot and ankle injuries. So here we have a foot. Now, one of the most common, most annoying problems, and probably one of the harder things for us to take care and get rid of, is plantar fasciitis. So plantar fasciitis. So if we look at the bottom of the foot here, so this would be a foot. Okay, this is a right foot model. If I'm going to flip it upside down, what we're looking at is the heel here. So the heel here, there's some insertion points. So right along the inside of the heel, which is called the medial plantar calcaneal tubercle, is the insertion of what's called the plantar fascia. And the plantar fascia is a dense fibrous membrane that goes from this point, and then it kind of splays out, and it crosses over the toes and attaches to the base of the toe just as it crosses this big long bone called the metatarsal. So it attaches right up and through here. So as we're taking a step, as we're coming over the foot, as the foot kind of drives over the stationary toe, what happens is we tighten up that fascia, and that fascia in essence takes the foot and kind of creates a locking mechanism in a retrograde fashion. So it kind of pulls the foot together and stabilizes the foot, because the foot's a pretty amazing structure. It goes from being sort of a rigid lever into a mobile adapter. So as it comes down to the ground again, it hits the ground in a locked position on the lateral aspect. So you're always going to have wear there, and then it collapses down. As it collapses down, it absorbs energy, responds to an uneven surface, a whole bunch of other biomechanical things happen, and then the body is going to pass over the stationary foot, and our pivot point should be over our big toe, critical player. So as we pass over the big toe, that puts tension into the plantar fascia, which pulls the foot retrograde into what's called the windlass mechanism, or it's labeled the windlass mechanism, that locks the foot back up together. So any failure of that system, some people have high arch foot or they have a really flat foot, they tend to get an overload of the plantar fascia, which is really sort of a micro tearing of the fascia at its insertion, and it creates a huge problem. So, a lot of our foot pain, pretty specific. So if we get in there and we just stick our thumb right in the bottom of your foot, you go, ouch, and be like, that hurts. Plantar fasciitis is one of those common things that we see and treat in the clinic, and characterized by first step in the morning, it hurts like crazy when I put my foot down, or after I've been sitting for a long period of time, put my foot down and it hurts. Tends to get better the more I use it, and then again with rest it gets irritated. Sometimes it can be created by trauma, so you step on a rock or something that can also irritate the plantar fascia. So plantar fascia is super common problem that we see, difficult to treat. Ankle sprains, also another one. If we look at the outside of the ankle, there are 3 ligaments that basically line up here, and then there's a bigger ligament complex to the inside. This is what's called the deltoid ligaments. There's 4 ligaments that comprise that. There's 3 on the outside. This is the anterior talofibular ligament, the medial calcaneal fibular ligament, and then there's the posterior calcaneal fibular ligament. So when we look at those structures, the one most commonly affected goes from the front here and attaches down and basically kind of sits like this into the ankle. Because of the structure of the ankle, you can see that this bone on the outside, the fibula, projects a little bit further distal than on this side. So the common process of spraining the ankle is going this way because there's nothing to stop it. If I take my foot and I try to go the other way, where are we? So as I go the other way, what happens is the calcaneus itself kind of buttresses up against here, so acts as a protective mechanism. So most of our ankle injuries occur down and then whoop, other way, like that, down and in. So most of the time we have an injury to the anterior talofibular ligament, and there are 3 grades to any ligament injury. A grade 1, which is a sort of a partial microscopic tearing of fibers. A grade 2, which is a partial tear up to 50% of the fiber. Very often you get bleeding because it pulls the capsule away, and then a grade 3 is a complete rupture. So those are common injuries, just quick ones that we treat here all the time. So if you have either one of these are definitely things that are treated extremely well by physical therapists. But again, physical therapists should be addressing the entire chain. So don't be surprised. You go to your evaluation and they look at the hip and they look at the knee and they look at the foot, because all those things are going to play into why I have problems. And each one of these little joints in the ear can mess up the whole system. So if you guys have more questions, love to hear from you at prescriptionfitnessphysicaltherapy.com, or go to our Facebook site, which is a link from our website. So love to hear from you.